So good morning, good afternoon, good evening. Welcome everyone to this Global Learning Network webinar organized by the 717 Alliance. My name is Mohammed Lamorde. I'm the director of the 717 Alliance. I'll give you some more information about the Alliance later in the call. Before we start the webinar, just a few housekeeping rules. Interpretation is available in French, in Spanish, in Portuguese. So please select your language in the meeting controls at the bottom of your screen. Also, automated captions in English are also available. Please activate them as needed in your meeting controls. If you want to ask a question, please use the Q&A box to ask those questions. And you can do this throughout the session. Some of your questions will be answered live during the Q&A session, and others in writing directly in the Q&A box. Also, the recording and the slides from this meeting will be made available over email after the webinar. So it'll give you an opportunity to review and learn more about this work. On our agenda today, we'll have welcome and introductions, which are ongoing, after which we'll have opening remarks from Dr. Stella Chungong. Thereafter, we will have a presentation on early action reviews by Dr. Landry Ndriko Mayigane. And then we'll have a question and answer session that is going to be moderated by Jobin Abraham. Thereafter, I'll speak again on some of the research and learning opportunities that are available through the Alliance. And lastly, there'll be closing remarks from Amanda McClelland. Our featured speakers today from the World Health Organization. We're really honored to have Dr. Stella Chungong give opening remarks. She is the Director, Health Security Preparedness Department at the Health Emergencies Program of the World Health Organization. After her opening remarks, she will invite our key speaker today, Dr. Landry Ndriko Mayigane, to give us a short presentation on the early action review guidance that has just been released by WHO. And so I ask you to pay attention as our distinguished speakers participate and give us critical information related to early action reviews and the 717 target. At this point, it's my pleasure to invite Dr. Stella Chungong to give us her opening remarks. Over to you.
Thank you so much, moderator. Good morning, good afternoon, good evening, ladies, gentlemen, partners, dear colleagues, and dear friends. Let me start off by thanking our partners from Resolve to Save Lives. I will not call everyone's name, but I would like to mention Amanda, Mohammed, and Jobin for your tireless work on strengthening epidemic preparedness, prevention, and control. And of course, I would like to thank you for inviting us, WHO, to speak here today. The COVID-19 pandemic has shown that it is crucial to have efficient systems for detecting, reporting, and responding to outbreaks. We know the importance of not assessing only the country's capacities, but also to have systems that are really well prepared to work in real time. At the Health Security Preparedness Department in headquarters, which I happen to lead, we are driving a lot of work around supporting countries to be better prepared for health emergencies. We work with member states and partners to strengthen public health core capacities and the full implementation of the international health regulations. We also support countries to provide global guidance and processes to monitor and evaluate the implementation of their international health regulations obligations. For example, simulation exercises are developed to help develop, assess, and test functional capacities of emergency systems, as well as their procedures and mechanisms to be able to respond to outbreaks or other public health emergencies. We also work around after-action reviews that allow countries to review what worked well during an emergency and what did not work so well, and how these practices can be maintained, improved, institutionalized, and shared with relevant stakeholders. Now, when it comes to outbreaks, early detection and rapid response are one of the most important factors to prevent them from getting worse. I can tell you this from my own personal experience during the 2014 Ebola outbreak, where I was the global incident manager. The window of opportunity to contain an outbreak is small, and the potential impacts on lives and societies is massive. It is in that spirit that early action reviews provide a rapid and agile way to evaluate the effectiveness of initial detection procedures and subsequent responses. And tracking timeliness metrics helps us to measure progress and pinpoint areas for future improvements. WHO published the Early Action Review Guidance in September of this year, and it leverages the 717 targets that was proposed by our partners from Resolve to Save Lives. The 717 approach is a simple method that sets targets for detecting a health threat within 7 days, notifying the authorities within 1 day, and completing early response actions within 7 days. Our main goal with the WHO Early Action Review is to identify the obstacles and the factors that aid in the early response and support countries to achieve the 717 targets. Using this approach, countries are driving towards ambitious timelines, targets, and other really critical indicators in real time. Findings from the EARs can help and channel the existing response frameworks towards informed policies and strategies, including the National Plan of Action for Health Security. It helps to recalibrate and prioritize emergency preparedness and response initiatives. We are delighted to collaborate with Resolve to Save Lives and the 717 Alliance in facilitating this webinar on early action reviews. Your engagement and commitment are vital to achieving collective advancements in health security. So I thank you once again for your efforts on this important line of work. Thank you, and back to you, moderator.
Thank you very much, Dr. Stella, for that excellent introduction. We do appreciate your support in this work. I'll now hand over to Dr. Landry Ndriko Mayigane, the Acting Unit Head, Country Simulation Exercises and Action Reviews at the World Health Organization. Dr. Landry, over to you.
Yeah, thank you, Mohammed. Good morning, good afternoon, colleagues. Control the screen.
Hello.
Can you hear me okay, Mohammed?
Yes, you're very clear.
All right, thank you. So, as we've seen in the recent years with the COVID-19 pandemic, outbreaks of infectious diseases can quickly escalate into global crises that impact millions of lives and disrupt economies. Several countries have successfully applied early detection, early notification, and rapid response strategies to prevent and control outbreaks as soon as they emerged, preventing them from escalating. I will use a few examples. I will start with Nigeria. Nigeria in 2014 was able to contain quickly the Ebola outbreak. As you know, the outbreak began with a traveler from Liberia who was later confirmed with Ebola. When they arrived at Lagos airport, they exposed more than 72 individuals. But the immediate activation of emergency operations to sophisticated contact tracing and community engagement were crucial in the successful containment of the outbreak. Vietnam, for example, effectively contained the COVID-19 outbreak by implementing early detection through robust testing and contact tracing, coupled with rapid response measures such as quarantine and isolation of cases. This proactive approach helped prevent the outbreak from spreading extensively. Another example, Kenya, in 2019, was able to quickly contain the deadly anthrax outbreak through effective surveillance and community engagement. These are just a few examples on how timely detection, effective surveillance, community trust in building are essential in containing and mitigating infectious disease outbreaks from the onset. The proposed early action review methodology is not just an assessment or a monitoring tool. It is a performance management process. It is conducted to evaluate timeliness of early detection, notification, and response actions in order to identify bottlenecks that delay appropriate actions and to propose remedial actions to solve them. Being agile, early action review uses a single target to simplify and standardize assessment of systems, making it easy for countries to prioritize investment and capacity building actions. In the context of continuous learning and improvement during health emergencies, an early action review offers the opportunity to evaluate the preliminary actions put in place, aiming to quickly detect outbreaks, identify any gaps and shortcomings before outbreaks escalate. As you can see, followed by an interaction review, which can be conducted during the response, especially for protracted emergencies, to iteratively course correct, refine the response mechanisms, and adapt to evolving circumstances. And when the outbreak is declared over within 3 months, as recommended as part of the IHR monitoring and evaluation framework, we also advise countries to conduct an after-action review to capture the lessons learned that were captured during the response and make sure that they are better prepared in the future. This, as you can see, we have early action review, interaction review, and after action review. It just demonstrates how learning can also start from the onset of the outbreak. We should not just wait at the end or when we are full in the response. (717) constitutes the bedrock of the early action review methodology that we are proposing. It offers a simple set of 3 timeliness metrics to assess early detection and response systems. 7 days to detect a suspected public health threat, 1 day to notify a public health authority responsible for action, and 7 days to complete early action responses. To implement the 717, we use an assessment tool that helps to collect data
Dr. Landry may not be able to continue immediately, but I'll speak a bit to some of these slides. And then when he joins, we'll take questions together. So as Landry mentioned, the 717 target is really used to capture and use information around detection, notification, and response. But critically, we also capture information around those things that help, outbreak detection and response happen. We call them enablers. And when we identify these enablers, we use this to support advocacy objectives, best practices, and improvements. But sometimes things don't go so well, and then you end up with bottlenecks. Bottlenecks hinder our timeliness targets, but they also hinder our ability to respond when events do occur. Now, when bottlenecks occur, we need to then take action. We call that fixing it, and you can do immediate actions for things that are easy to address, relatively low cost, and for which partner support is available to address at the beginning. But then you could also have longer term actions where you have to prioritize and plan and project into the future for some of the larger kinds of events and bottlenecks. And what we see here is that countries have the opportunity to incorporate those activities that address their bottlenecks into national action plans for health security, for example, or other national planning mechanisms that countries may have. The critical thing here is that 717 is very local. If you're implementing the 717 and you're having an early action review, often at that time you have stakeholders that are at the front lines, at the district level, or maybe district level partners, and really bringing out this opportunity to have immediate actions where they can contribute to keeping an outbreak small is one of the critical innovations that has come out from the 717 target. Next slide. And so we have opportunities to utilize the target for different objectives. Performance improvement is what I've just described, identifying bottlenecks, quantifying what is needed, and providing immediate and longer term actions. Second, we have prioritizing for financing and system strengthening. Because you're able to identify specific activities that address those bottlenecks, you're able to then push those activities up if they already exist in a current government plans. Those activities can then be prioritized and then used to address issues that hinder our detection and control mechanism. We can also use 717 for communication and advocacy. When presented with simple metrics, political leaders and donors can clearly visualize resource needs and necessary interventions substantiated by clear data. And a simple example around this is around when you have an event. Sometimes stakeholders might want to wait for plans to be developed to address those issues, but the planning process itself might be delayed. What early action reviews do and provide us with 717 metrics around the event, as well as those immediate action in a clear manner that can enable stakeholders, including local actors, to contribute at the right time and address those issues. And lastly, the 717 target has been used around accountability and reporting. Reporting against single metrics can be used to monitor performance. For example, large investments in strengthening health security across different technical areas can be assessed by 717 to see that those technical areas, when strengthened, are actually functioning together to improve timely and effective responses. In addition, we have background literature around 717 that we can refer to. There have been 2 publications that really outline the structure of 717 as an organizing principle, but also pilot data from countries that have started to use the 717 target. The model for 717 was piloted in 5 countries, and 5 countries had the opportunity to incorporate to their systems, test adoption and use by engaging stakeholders, but then also look at events retrospectively that had occurred in those countries to see how they had performed. Critically, for the 717 target for the 5 countries that included Brazil as well as 4 other African countries, if you looked at the metrics independently, about half of the events met the first 7, and about half of the events met the second 7, and just over 2/3 met the 1 target. But if you looked at one event meeting the entire 717 target, only 1/4 of events met the full target. And this is really where we want to put our emphasis. We want to see that all events meet the full 717 target. And so these are papers that can show you more information around what was done in those countries and the data that are available. And so this is a commentary from the WHO. The slides will be shared after the call, where early action reviews basically take on what we know about the 717 target and use it for gradual learning from real-world actions. Unlike intra-action reviews, which happen only for prolonged outbreaks, and after-action reviews that tend to happen for the larger events, with early action reviews, you can actually review each event and learn from each event and use that as an opportunity to improve. And this commentary really talked about galvanizing and communicating clearly around what the 717 target could accomplish. We believe that the early action review approach highlighted by WHO provides the clearest guidance that countries can use to implement the target and address issues related to early detection and response. And so critically, every event becomes an opportunity to learn and to improve. We document performance from each event. We review performance and calibrate the response. And then for the longer term actions, we incorporate to national planning. Where planning may not be possible, advocacy and even larger reviews can also be used as opportunities to really elevate the challenges that are being faced so that they can be addressed for improved performance. And so supporting tools are available. There is a website that the WHO has set up that provides the tools. And so it's possible for you to pull out either the early action assessment tool that Dr. Landry mentioned earlier, or event review templates, post-EAR action trackers, and synthesis templates, where you can actually summarize across multiple events. So there's one more slide. I want to check to see if Dr. Landry is able to speak at this point. And you might want to speak to this specific slide.
Yeah, can you hear me okay?
Perfect.
Sorry, I lost connection in the room and I was not able to connect quickly. Sorry for that. So this is, and thank you so much for stepping in, Mohammed. So it's a clear demonstration of agility to be able to step in and take the flow and keep the ball rolling. So this slide actually is really a summary of what you can expect from an early action review from a country. It really summarizes everything in one slide. As you can see, for a country that has conducted an early action review, this is an example of Uganda. As you can see, it starts with that assessment that is around the target, the 717 target, trying to see how many days that it took for the country to detect the outbreak, how many days it took for the country to notify, and how many days it took the country to activate, to trigger the early actions. As you can see here for Uganda, as an example, for the SVD, it took them 46 days before the outbreak was detected. But in less than 1 day after the detection, they were able to notify the competent authority. And within 9 days, all the critical actions were triggered. So here, the idea is not just about populating or documenting those numbers, but also is to reflect why 46 days. What are the bottlenecks? What are the challenges that the country encountered that maybe have led to the 46 days? So as you can see here, those are some of the bottlenecks that have been summarized here. You know, it could be, I mean, it was the lack of knowledge on IDSR, integrated disease surveillance, suspected on IDSR in terms of case definitions. So a lot of people didn't know the case definitions, especially in the private facilities. From COVID, community-based surveillance was really tight. As you know, how COVID-19 pandemic has overstretched our health systems. So there was that fatigue. So this contributed in the failure in identifying suspect cases on time. However, there were some enablers also that helped in that detection process. As you can see here, syndromic surveillance system that is in place in Uganda for viral hemorrhagic fevers, which really contributed a lot. So they have identified the bottlenecks for both for detection, for notification, but and also for response, and they were able to propose some actions. In terms of immediate actions, it was about identifying and building better facilities for isolation, identify partners that have resources that can help to support contact tracing. So this was immediate action that was taken for remediation, but also in terms of long-term, there was a need to amplify the training around IDSR. So this is an example of what an early action review can look like after a country has conducted it. Next, please. So I'd like to finish by thanking the colleagues that have really contributed in developing this guidance and tools from WHO, the colleagues from my units, Candice, Armand, Elliot. I'd like to acknowledge our regional colleagues and country offices. But most importantly, I'd like to thank Resolve because they're the one who set the stage on this tool by proposing those targets, which are very, very important. So we're just building on those targets in the EAR methodology, early action review. I would like also to acknowledge our colleagues from CDC. And finally, would like to acknowledge also Uganda for being the champion in pushing this new tool and integrating it as part of their surveillance systems. So in conclusion, an early action review is not just a methodology, it's a necessity. In a world that is increasingly vulnerable to large-scale health emergencies, being proactive rather than reactive could save lives, resources, and preserve the integrity of our health systems. I'd like to thank you for your attention. Again, apologies for that technological glitch that happened. Over and back to you, Mo.
So thank you very much, Dr. Landry, for that presentation. At this point, I'll hand over to Jobin Abraham. He's the Director, Leadership, Governance and Financing for Health Security at Resolve to Save Lives, and he's going to moderate the question and answer session. Jobin.
Hello, everyone. Thank you for joining our session today. So this, in the beginning of the webinar, we had the opportunity to be kicked off in this conversation with Dr. Chungong, who shared with us the importance of this early action review approach in the IHR monitoring and evaluation framework. So thank you so much, Dr. Chungong, for that. And then from there, we heard the details from Dr. Mayigane and Dr. Lamorde, but what does that actually look like in practice? We saw some examples. And Dr. Lamorde also shared a little bit about what does it mean to have a thoughtful research and learning agenda around this new approach so we can learn and prototype this approach together. So if we've inspired some questions amongst all of you, we've done our job right until now. So what we're going to do for the next 15 minutes or so is actually take some of those questions that we received in the Q&A and start answering those questions since we had Dr. Mayigane and Dr. Lamorde here with us. So to kick us the conversation off first, Dr. Mayigane, this is the first question for you, which is, can you say a little bit more about how do you see the 717 indicators relating to the IHR monitoring and evaluation framework, the existing indicators, the existing approach?
Okay, so as part of the IHR monitoring and evaluation framework, as you all know, we have the SPAR, we have, the state party annual reporting, which is mandatory, and we have 3 that are voluntary. The first one is GEE, Joint External Evaluation. Dr. Stella talked about simulation exercises and after action reviews. So of course, after action reviews, as you could see, as part of that continuous learning, starting from the early phase of the response, it has expanded to include interaction review, and now we are talking about early action review. So in terms of indicators, as you can see, it's all about performance improvement. So countries conduct early action review, they'll be able to identify some of the challenges, some of the bottlenecks that that the country are facing in terms of detection. So as you know, part of the indicators as part of the state party annual reporting, or the indicators part of the joint external evaluation, also includes indicators around detection. There are indicators around notification, there are indicators around response. So if we address those bottlenecks during our early action reviews, we are going to contribute also to the score that the country has as far as detection, as far as notification and response is concerned. So all of these work together and contribute to improving the capacities of countries as far as responding and as far as detecting, responding and responding to health emergencies. That's all I can say.
Thank you, Landry, for that very clear explanation of how all these different pieces mutually reinforce each other. In the vein of how things connect together, our next question is, do early response actions apply only at the national level, or is it also at the district or regional level? We have a number of colleagues on the line here asking for what are some examples or models of how this approach might help the national and subnational entities work more closely together. I invite both Dr. Lamorde and Dr. Mayigane to speak to that. We'll start with Dr. Lamorde.
So thank you very much. So, as I mentioned just briefly, early action reviews have that opportunity of, addressing an event at the start. And that's really the best chance we have in terms of either mitigating or even stopping it from becoming a pandemic. So early action reviews have this opportunity to really strengthen our response capabilities right at the very beginning of an event. Because of that, nature of early action reviews, it's inherently local. Initially it would be a local event, and most countries would expect their local authorities to start off the response. We also know that in many countries, local authorities don't have sufficient resources, say, for a full-scale outbreak, and they would then require support either from regional or state level as well as national level, depending on the nature of the event. However, being able to identify those challenges very quickly can mean that local actors and local partners are able to address issues that might be as simple as, inadequate petrol to, conduct investigations, things like telecommunications gaps, really basic issues that could have a huge impact on the overall outcome of an outbreak can be addressed at the local issue. However, for events such as like an Ebola outbreak, you definitely would want the entire country's resources to be galvanized to support as quickly as possible. And so early action reviews also highlight those needs and requirements for the national response teams that would then work with the districts and regional teams to strengthen the outbreak responses. So it's across the system, but we really want to see it adopted all the way down to the local level, so that we improve our best chances of identifying something like, a COVID-like event in future. We want to make sure that at the local level, we're putting our best foot forward in terms of detecting and controlling it.
Thank you, Dr. Lamorde. Dr. Mayigane, any other points to that?
Just to say that outbreaks start in communities and also controlled in communities. At the national level, we can develop strategies, but a lot of actions actually happen at the community level. So positioning early action review and the 717 targets and making sure that concrete actions in that regard are taking place at the community level, this will, of course, prevent outbreaks from going out of control.
Excellent. Thank you so much. So now we have some people on the line as they are starting to think about the value of this, really thinking about what does that look like in terms of implementation. So this next question is around what that implementation practice could look like. So Dr. Mayigane, this question might be best for you, which is, are there some standardized resource requirements for conducting early action reviews, interaction reviews, and after action reviews? What might that look like from a human capital, financing, logistics standpoint? What are the minimum requirements to be able to do this kind of work effectively?
The first one is willingness to do it. And because if countries, start expressing their interest and their willingness to conduct this activity, it will make it easier, because what we do in WHO is to propose some standard tools that countries can use. We did this for after action reviews, for interaction reviews, and we're also proposing the same for early action review, building on the 717 target. So we always encourage countries to take those tools and adapt them to their context. So the good thing about early action review, it can be conducted in a light manner without deploying a lot of resources. So by positioning it, for instance, at the EOC level and building that culture of learning, so that people do it systematically and documenting those bottlenecks and trying to raise them up when necessary to address them, especially when they require immediate actions. If they do this in a continual and a consistent manner, I think it will be easier to be implemented. Early action review can be done, in a very light manner, because remember, the priority is to stop the outbreak. So we don't want to take the focus from the response and to put it in that assessment. So the lighter you do it, the more consistent way you do it, the better.
Thank you, Dr. Mayigane. You and I have worked together long enough that I knew that you would start with the willingness piece around creating that culture of quality improvement and learning. And actually, our next question actually ties a little bit more to that, but maybe a little bit more on the technical side, which is both to Dr. Lamorde and Dr. Mayigane. This question is, as much as 717 might be a monitoring tool, it could also be a CQI tool, a continuous quality improvement tool. What are some for folks on the line who are just getting introduced to this, from a technical perspective, what are some resources or approaches or steps you would direct them to so they can think through the technical pieces of how they can use this as a continuous quality improvement tool?
So the first one is, first of all, please make sure that you can access the link that is on the chat box. And also through Google, of course, you can very easily retrieve the tools and the website where you can learn more about what we are proposing. The other way also is to reach out to us, and then we are going to make sure that we can find a way to provide the support that is needed. What we usually do in WHO every time we develop a new guidance, a new methodology, we always conduct some activities to support the rollout or accelerate country uptake of that guidance or new methodology, which includes conducting a series of trainings. So there will be a series of trainings that we'll be conducting in collaboration with Resolve to Save Lives. So Mohammed will talk more about it. There will be, we are going to identify a few countries just to work with to create, some good examples. We already have examples like from Uganda, but we want to really magnify and have as many good examples as possible, and also followed by case studies that we will publish so that we can generate more evidence that are published, that are accessible for other countries for them to use when they want to conduct this early action review. We also support, we provide technical support to countries when needed. If they require the technical support, they always come to us or request that through our regional country offices. We're always available to go into the country or to provide remote support as needed. And of course, in some cases, and when the resources, funding are available, we also provide some funding also in that to support that.
Thank you, Dr. Mayigane. Dr. Lamorde, on the technical side, any recommendations, but also another related question, which is how beyond, in addition to looking at the technical pieces of how to implement it as a CQI approach, how might institutions start to think about institutionalizing these practices in the longer term?
Thank you very much. I think just to add, we see that you're using it as a CQI, you have to really use the same elements that make any CQI intervention successful. You have to have transparency, but also a non-punitive approach. So it's a no-blame culture. Leadership is critical in ensuring that we're able to create that type of environment. Willingness to share information and learn from those lessons. These are critical, and we use the approach of the community of practice to really encourage countries to get to that point where the CQI approach would really work. In terms of institutionalizing, I think during the adoption phase, it's absolutely critical that you identify a coordinating agency in a country. Typically, this will be a National Public Health Institute or a National Emergency Operations Center. And what we really want that group to do is to focus on integrating data capture for 717 into routine workflows, sharing it into stakeholder meetings that already exist, and taking advantage of decision-making mechanisms that are present for planning and resource prioritization. So really working with the right government agency is absolutely critical during the adoption phase, and then bringing other stakeholders on board to support and understand what that agency is doing. Thanks.
Thank you, Dr.
Maybe.
Oh, go ahead.
Maybe also in terms of institutionalization is to integrate 717 and early action review as much as possible into existing mechanisms and systems and frameworks, including, I talked during my presentation about Uganda, the integrated disease surveillance for Africa, and we have also a similar framework for other regions. So if we integrate it there, this will support the institutionalization. The other way also, we have the NAPS, the National Action Plan for Health Security process, where we can also integrate the 717. So if we feed it into those existing frameworks, this will also accelerate that institutionalization.
Absolutely. Thank you, Dr. Mayigane and Dr. Lamorde, for talking about the importance of integrating all the different processes associated with the IHR-MEF at the global, regional, and the national level, and for acknowledging the importance of creating the right leadership enabling environment that will allow us to actually truly learn and create that culture of accountability and learning.
Right. So I'm going to talk a bit about some of the opportunities for research and learning that we'll have for 717. Next slide. Now, who are we? We're the 717 Alliance. We're a country-led initiative that provides technical assistance, financial support, and a growing global community of practice to help all countries achieve the 717 target for outbreak control and detection and control. What we're doing is we are a global secretariat, and we provide support to countries to take the lead.
It's the laptop, I don't know what happened, but I'm calling him.
To take the lead in implementing 717 in their countries. We accelerate progress for all countries to achieve this target by doing what we're doing today, amplifying the evidence and guidance around 717 and early action reviews. We support countries to adopt and use 717 and implement the early action review approach. And then we help countries learn together for operational excellence. And this is done by countries exchanging information amongst themselves through a community of practice, but also through sessions where countries can then share experiences. More recently, we received funding from the Wellcome Trust to establish a learning network and joint research agenda so that we actually learn more around the implementation of 717 and see how best to strengthen implementation in countries. Currently, the number of countries that are participating in the global community of practice is 15. And the community of practice comprises individuals that are really at the front line for preparedness and response systems in their countries. They come together through webinars, and then they share information on what is working and what is not working. And they have the opportunity to brainstorm solutions together for some of the challenges that they're experiencing. Following this webinar, there will be other opportunities to learn. And one of this is going to be an early action virtual training series. This training series is going to happen in January, and we're going to have 3 weekly sessions, so 1-hour sessions for a period of 3 weeks. And through these sections, we hope to support all interested individuals to build up their skills on using the 717 target and conducting early action reviews. It's aimed that these activities strengthen the practical skills and not just a theoretical approach. The registration for this will open in December. Space is limited, so please, if you are interested, take time in December to register as early as possible. Those sessions will cover things like simulation youth exercises, country adoption and use, and also performance improvement and management. And in addition, we shall be issuing out small grants, research grants around our research agenda that aims to strengthen that evidence base for using the 717 target as an effective organizing principle to prioritize health security system improvements. And the notice of funding for that will be out in December. Expressions of interest will be due in January, and then proposals would be received by February 2024.
So for all of you who are wondering, this webinar is recorded, and our team will be sharing this recording along with all the associated resources we mentioned today with you shortly. We've been able to address a few of your questions, about 4 or 5 of the questions that rose up to the top. But we know there are a lot of other questions that we were not able to answer during this Q&A session, and our team is in the background taking note of all of these, and we'll be following up with you very thoughtfully in the next few days. Now, to wrap us up, I have the pleasure to introduce our Senior Vice President for Resolve to Save Lives, Amanda McClelland, to close us out. Over to you, Amanda.
Thank you so much, Jobin, and thank you to the whole team and the more than 200 people that stayed with us despite some technical issues during the conversation. I think the key for me, listening to the various participants today and to see the breadth of people that have joined in the chat's been fantastic to see all the names and locations come up, is really the need for simple but consistent approaches to help us improve our ability to find, detect, and respond to outbreaks. And 717 is a combination of a number of different approaches and learning across several years, and we are pleased to be able to support WHO in accelerating the implementation and looking for those good examples that Dr. Landry mentioned. This is about creating a learning culture, as Mohammed said, creating an ability to identify where we could do better without blame, and really focus on how do we get to subnational level and find and respond to outbreaks at that community level, and understand where we're doing well and celebrate that success, and identify where we could be doing better and improve those processes. We look forward to partnering with many of you in the coming weeks and months, and hearing from you how you've been able to use 717 to really improve your systems. There's a lot more to learn here, a lot of good examples to be able to highlight, and I think for a change, maybe celebrate our success around the epidemics that we stopped from happening, rather than always highlighting those outbreaks where we perhaps could have done better or where they got away from us. So I really look forward to learning more from you, to continuing to support the Alliance and our collaboration with WHO, making sure that more countries, partners, and local communities can engage in this approach so that we can build a safer world together. Thank you all for joining, and look forward to this being the start of an ongoing conversation. Thank you.